So our panel here is really going to talk about, everything ranging from massive global events like war or Ebola to getting even closer to home with the drought situation in California. How do we handle these different situations? How do we get up and actually act upon them and learn collectively and be able to drive the creation of more solid communities and systems that protect us better as a community? One thing I just want to say is that, earlier in the opening presentation, one of our panelists, I believe it was Prannoy, might have said, I think he used this phrase, that rich or poor, everyone becomes underserved in the face of true disaster. And I think that's incredibly poignant and very, very true, especially for the panel we have in front of us here. So our moderator for this panel will actually be Enoch Choi. And if you were in this room for the last panel, you saw him up here as well. And so when I first tried to get in touch with Enoch, I had the hardest time getting a hold of him, and I thought, maybe he just doesn't like me. But what I've since realized is that he's just incredibly, incredibly busy. He was seeing patients up until the moment he arrived here. You can see he's still in his scrubs. And so we had him as a surprise moderator for the last session. We're happy to really have him for this next session as well. And so with that, I'd like to turn it over to Enoch, and then the rest of our panelists will introduce themselves as they each do a short presentation of their work. Thanks.
Well, welcome to our panel. I'm so delighted to be joining you, and glad that a lot of you guys stayed. As opposed to the last panel where we had very interesting granular technologies that were applied by clinicians at the point of care, we have much more broad-ranging technologies and systems and programs to describe to you in this panel, which I'm really excited about because as a provider of urgent care and emergency services, I was just sewing somebody up just 2 hours ago before being here in the Old Mills ER, if you know of the urgent care nearest to here at Palo Alto Medical Foundation. But I'm so excited to join you here because I'm on the board here with Prannoy, supporting him in this organization, and I've been an entrepreneur and helped out with startups and been very involved with consulting with electronic medical records and bringing those kind of technologies abroad, not only providing that care here locally, but I do a lot of disaster relief, and that's how I got so excited about what Prannoy does, is that he's introduced me to, and the last organizer with Vodafone, June, had introduced me to so many great technologies that I can see that can be helpful in disaster zones that I help out with, and locally here. So I wanted to, each one of the panelists will share a little bit about them. I just wanted to share a couple things about the organization that in my free time, although I practice full-time and see patients, I also am the medical director of a nonprofit called Jordan International Aid that provides short-term deployments for a few weeks for providers, physicians, nurses, supporters to give free medical care to people in disaster zones. Our newest project will be leaving for Nepal in August 7th for 2 weeks. And that's enabled by local donors. Vodafone's been a supporter. Many of the organizations that support the HTF here have been supporters. We bring those medications, supplies, and connectivity, for example, the Vodafone connection. We've been to all the major disasters, most recently with Philippines, and I'll show you a little video about that work, to Japan's tsunami, 14 trips to Haiti after their earthquake, ongoing yearly trips to Kenya and Cambodia. My first trips were to Katrina and helping out in St. Bernard Parish, being the first physician in the parish to help out. And recently Sandy, and also further in the past in Indonesia and India. We're 100% volunteer. There's no salaried participants there. Everyone is a volunteer, and we're mobile. We're not really tied or directed by any particular organization, so we can really try and find out where it is the most, where the most need is, and we bring the physicians and nurses to those areas. If this works, I hope. And it'll show a short, just 2-minute video.
When a typhoon ripped through the Philippines, it left visible scars across the country and killed thousands of people. But what it did to the souls of those left behind can be seen in this one remarkable yet sad picture. This is a woman who clung to a tree with her 11-month-old baby as 235-mile-an-hour winds blew them across a bay. The last thing the mother remembers is being on the tree with her 11-month-old. All 6 of her children died in the typhoon. A small glimpse of a tragedy. But the crisis is growing long after the storm has gone, and deaths are mounting. That's because poor sanitary conditions created by a lack of infrastructure after the disaster means diseases are spreading, causing long-term health issues and death. That's why Jordan International Aid assembled the best medical group and critical medicines, flying into the heart of the disaster, led by Jordan International's Dr. Enoch Choi.
The hearts of the Philippine government and the people will open up and see that Americans want to come and help just as we have come.
Before the death toll grows higher, one of the conditions afflicting many people here is diarrhea. It might not sound like a big deal in America, but the Centers for Disease Control says more than 801,000 children younger than 5 die from diarrhea in developing countries each year. And that's not including when there's disaster. That's why people like Dr. Arthur Dover from LiveLeaf are here to help children and adults.
You take all of this and then take a little clean water.
He's giving ailing people in the Philippines Life Drops. Life Drops are created by the company LiveLeaf from natural ingredients to help slow the rising death toll from diarrhea. But there's much more to be done, and that's where you come in. Jordan International Aid needs your help raising money. Go to jiarelief.org, and there's the button right there that will enable Jordan International to send more doctors and aid to those who need it so much.
I'm so excited that from the very hands-on aid that we're able to give to people to what you're going to hear next, the organization it takes to deploy that kind of aid, to respond and to monitor and to find out where it is that that aid needs to be deployed. I'm so excited for these 3 panels to be participating. So please, a big round of applause for our 3 panelists that I'll be sharing now.
I'm sensing a little bit of post-lunch sleepiness, so we're going to start off with some calisthenics. A quick show of hands. When the Ebola crisis was mounting and we're reading the news and hearing about what was happening, how many people felt at some point like that they wanted to help in some way? Great. Keep your hands raised. How many people knew how they could help? That it was clear to them? Great, yeah. What we saw during Ebola was this mass interest in supporting, right? Is that this was a moment of people all around the world really realizing that this was something that was devastating communities in West Africa and that posed a great threat to potentially everyone. And we saw all sorts of people reaching out, trying to get involved. And what I'm going to talk about today is one method that we think we can start enabling more people around the world, whether you are a doctor and you have the medical knowledge to go, or if you are an entrepreneur, a technologist, a designer, some sort of other type of creative problem solver that might have some ability to get involved. Really the theme of this talk is about how technology is enabling more people from around the world to collaborate, to be able to contribute as crises mount or as just large problems that we're facing on an ongoing basis demand more people to be involved. So let's do a quick hand raise again. How many people have heard of the company IDEO and have a sense of what design is? Cool. So I work for IDEO. We are a design firm. We were started about 30 years ago doing product design in Silicon Valley, things like Apple's first mouse. We've taken the design process and methodology that was used for product design to be able to apply it towards all sorts of complex situations, designing experiences, organizations, ecosystems. So not just products, but using it as a problem-solving technique. And inherent in it is a few core values. Empathy, really trying to develop an understanding of the needs of those that you're designing for. Collaboration, really the insight there is that we believe great innovation comes from diverse teams working together. And iteration, being able to constantly revise your design based upon the feedback that you get through prototyping, is making your ideas more real quickly, getting feedback so that you can improve the ideas and the projects before you actually roll them out. So at IDEO about 5 years ago, a group was realizing, well, we have this methodology that's working in all these fantastic ways for the projects that we work on. What could we do what kind of impact could we have if we open it up and let the world use it to help address some pressing global issues? And that's what we do. Is really the idea is that some problems are too big for any one organization to solve. And we felt that as IDEO and as designers, and we wanted to see what can we do if more people were invited into the same process and enabled not just to use design and a structured process of designing and problem solving, but also allowing them to collaborate with people around the world. And so that's what Openideo is. It's part of the company that I get to work with, and we are an open innovation process and platform. We've done about 30 challenges, about 85,000 people from around the world have participated. And I'm going to talk today just about a couple of challenges related to health. The first one is Ebola. Remember the same statement, no one organization can solve some of today's biggest problems. So as the US government was trying to figure out their response to Ebola, one of the first things that the president did is he put out this call that they're looking for inventors and entrepreneurial talent, looking for new solutions. And this speech was given, I believe, on a Wednesday or Thursday. On the Friday, we received a call from USAID saying, the president's announced this challenge. We'd like Openideo to help support it. And so we quickly launched a challenge on how might we rapidly equip and empower the care community to respond to Ebola. And we'd never seen a turnout like this. Just immediately, people were coming to us, not just participating in the challenge, but offering to come to our office to volunteer, offering to host events. Actually, Purnoy and the Health Tech Forum hosted an event in support of the challenge. We were receiving people who wanted to act as experts and be able to judge different ideas that are coming. And this was, I think, in large part just because of this, how much volunteer interest and sort of latent energy there is around crises that are mounting, and how much people do want to help when there's a productive way to do so. Ultimately, we saw a great success in the challenge. USAID and the White House were really happy with the turnout and the response. We had over 1,000 unique submissions to the challenge in just about 5 weeks. Several ongoing initiatives were catalyzed through them. Over 20 ideas were then forwarded to USAID for funding. We saw dozens of events bring people together offline in support of the challenge, which is something that happens for a lot of our challenges. We always have offline meetups and offline gatherings to support the challenges, but especially for this one, we saw a great turnout and also people coming with a really high degree of sophistication in terms of their skill sets and their experience. So we had NASA researchers, we had people with patents in all sorts of different design and technology. And we saw them not just lending that expertise, but using it in a collaborative fashion so that they're commenting on each other's ideas, giving feedback, and helping each other improve and rapidly deploy. So that's a little bit about our Ebola challenge. We right now are addressing a different challenge, which is health disparities. something that I'm sure everyone in this room is pretty aware of, but maybe less outside the room is that there's a very high correlation between socioeconomic status as well as different cultural factors in terms of health outcomes in the United States and elsewhere. And so we have a challenge that's sponsored by NBC Universal and Telemundo, which is focused on using technology to help all people lead healthier lives. The challenge right now is just in the research phase, meaning that we're accepting submissions of perspectives from around the world of success stories, of challenges, interviews, trying to get a sense of where is health access or health information lost in translation, what are some barriers that we need to overcome, and then we'll soon launch the ideas phase where we're accepting new submissions, and really the hope is one, to catalyze new efforts where people are able to start addressing this question in their own communities, but also to suggest ideas for NBC Universal and Telemundo to pick up, because they're looking to deploy more efforts around improving health outcomes and looking for the ideas that a creative and open community can share with them. So that's my very brief overview of what we do, but I look forward to questions, and please do come up to me. And I've tried to distribute a few cards on this challenge so you can take a look on your table and participate.
Our system is very linear. Some describe it almost as a paramilitary structure where government agencies support one another. Disasters start out in some locality, like right here in Burlingame, that a traffic accident could occur. Police respond to it. But if something big were to happen, it's still going to have a place, oftentimes, especially when we look at something like an earthquake. And so those people will still be in charge. But then we start layering on different kinds of support to that from all the different sectors, starting within government up to the county, the state level where I work. We have access to the federal government, other states, FEMA, you may have heard of. All that stuff comes together in this sort of linear fashion, and we use this all the time, every day, for things like the Napa quake, to the oil spill that happened down in Santa Barbara a few days ago, to long-standing emergencies like the drought, which really kind of has no end in sight. So this works. And don't worry about the kind of weird terminology, but what I was trying to show is that we have an organization structure that, unlike day-to-day life, it always looks the same in crisis management. So that was one thing that California learned a long time ago and really adopted out of the fire service, is that you have to have a common structure. You never know how much you're going to need or where it's going to be needed, but if it happens, you don't want to waste a lot of time trying to figure out how to get to know each other and who does what. And that spans everything from how people are trained to respond in a common way so they can come and help each other, to also things like their communication systems, so that they can be interoperable. So all that stuff has to be common, and that's really been important and something that's been proven in California to be the most effective. And when you think about it, how easy would life be if we could always kind of use the same structure all the time for everything? I mean, even my day job, when I'm not over in our operations center, is a little more complicated than this. And I often wish for the simplicity of disasters, believe it or not, because it does all come together out of necessity to be very, very common. So if you see a big fire in California, there's going to be firefighters from all over the world that are responding to that. But we're able to do that very quickly because they've all been trained in the same concepts to work together and seamlessly and kind of surge and shrink the response to meet the need. Then it gets interesting because we can't just rely on that system of government stuff. There'll never be enough, really, to respond to the biggest thing that could happen in a locality. And like all of my co-panelists, all represent different sectors that are not government, whether it's volunteers or business community or innovators. All of that stuff, as you've heard already, has a place in disaster management. So how do we take that sort of linear structure and fold all this in? But it's very important that it be inclusive. And the fact of the matter is, a lot of the stuff's going to be going on at the neighborhood level, and we might not even know at the state because it's happening. There are non-government organizations and nonprofit that are helping people every single day with their own crisis that they have in their lives. Those are going to be first responders as well. They're going to be helping people with things that they need in an event. There are sort of known nonprofits that, like the Red Cross, of course, that has a portfolio for disaster management, but there's a lot of that stuff locally as well. Volunteers, already mentioned, there's a big willingness to support. There's organizations like yours that are organized to do crisis response, and then there's the spontaneous volunteers. There's the goodwill that comes out that wasn't there before, like Jason talked about in Ebola. And people just need to know where to connect. Where should I send my money? What can I do? And we've got to be able to manage both, the organized volunteering as well as the spontaneous. And when I say manage, I don't mean the states like getting in everybody's business and trying to do this. It would be not possible for us to do all that, but we need to know that that's working all up and down that chain that I mentioned at all those different levels. And if something's missing, then the different layers of support can come in and fill in. Of course, there's government. There's hundreds of thousands of first responders just that are employed in that field. And of course, there's a whole volunteer segment as that. And then the private sector. Private sector is anything from the homeowner, the individual in a community, to business, to you name it. So all of those entities have a role in disaster response. So it is our charge and everybody's charge to figure out how that all works together to meet the needs of people. And disasters like the big dinner party you're planning, then there's a lengthy menu of stuff that we have figured out that are needed in any given event. So if we have an earthquake, we're probably going to have problems in all of these areas. And so therefore we have to figure out who can either fix a problem or provide a service or let us know what's going on in every one of these sectors. And you never know, sometimes you might need 2 or 3 are prominent, sometimes you might need all of it. But this is how we've organized and described in a way that is understandable, hopefully, of the different kinds of things we need to be capable of restoring or that are important to people, and that we've got to figure out who all the players are, whether they're government or non-government, that can do these things to help us get roads and bridges back open, to help us find people or do search and rescue like what's happening in an earthquake situation like Nepal. Utilities, that's huge, the lifelines that we all depend on and span many, many different elements in and of themselves when you think about power and water and all those things we rely upon every day. So these are our disciplines that, again, taking that first linear structure, looking at all the sectors, and now all of these types of things that are important to us and that will often be impacting a disaster. So packaging that all together. And by the way, in California and elsewhere, we're at risk to just about everything. So we never know, all these things could be going on all at once, and in fact they were. In California. That image is from the Nepal earthquake, but we had the one a little bit closer to home here in Napa back in August. Same time we were grappling with the drought that really came beginning of 2014, really came to realize was turning into a crisis situation. And Ebola, of course, was happening all around the same time. So that's just a few. Those of you who are Californians know that there's many more behind that. So we have to be ready for all these things anytime, using all those other systems that I mentioned. So that's pretty daunting. And unfortunately or fortunately, California's faced a lot of these things and has put a lot of things into place to deal with it pretty well. Starting from that system I mentioned, all the way to working across sectors. And that's because we've had a lot of practice. Because that's, our state is wonderful. We're also at risk to a lot of catastrophes. So we put a lot of work into that. But we're here to talk about community resilience and really, how do you sort of turn that corner and make sure that California or elsewhere or wherever field you come with, we're able to withstand a crisis is really our goal. We know we'll have to respond to them. We know that disasters are a reality. But our wish is that our communities can withstand a disaster as best as possible. That's just the best thing, kind of goes without saying. And so how do we do that? How do you turn this kind of negative, sort of aura around disasters into something that is a little bit more positive? And what's interesting I wanted to end with is I took a couple of shots of education campaigns that I found related to disaster preparedness. And you look at that negative connotation, oh, that looks a lot more positive. And what we found in our own research at OES is that in order to educate people or get people to do something to prepare for a disaster, and we surveyed, we did a scientific thing and talked to a lot of people, to actually get them to take an action to store water or have a first aid kit or whatever, all the things that we try to get families and households to do. They weren't motivated by fear. by talking about the big earthquake that we're all going to see in the movie Day After Tomorrow, in San Andreas, where the rock goes and saved everyone. That still doesn't. We hope that movie kind of gets people talking about earthquakes and preparedness, but that in and of itself is not a motivating thing to get people to take an action. It just didn't work. What motivated people was to appeal to their higher values. So take a disaster description and say, oh, an earthquake is bad, it's going to wreck your house, and all these things are going to happen. And switch that to, don't you want your family to survive? Would you like your house to be intact? All of a sudden, that is much more appealing. And I commend City and County of San Francisco because they have this campaign called SF72, and I just pulled it up on the web and cut and pasted it in here because it's pretty positive. You see the people, they're looking at their beautiful city and having a nice day. They want to retain that. Even though that's all about earthquake preparedness, that's not what you kind of inherently think about. You think about, oh, this is really nice. We want to save this. We want our family to be intact. We want to do something in our community to help our city be more prepared, whether it's whether it's supporting a measure for resilience and that with political leadership or just doing something in their own home. Same thing, FEMA has a campaign called Ready.gov. Ready sounds very positive. It sounds empowering. It's again a positive. We here in California started something called Shakeout. It's kind of a fun way to describe earthquake readiness, and it's a little one-day drill that we do. Everyone learns how to drop, cover, and hold on, and like 9 million Californians have registered to participate in it. They're really getting into it.
So we have had a framework for addressing these community responses, our governmental response, and now we have the Skoll Foundation. Alexis will present just two of the many, many projects he says that he could have been speaking all day, I think, on, but two really, really cool technology approaches to addressing the problems that we heard from the last two speakers.
Thanks. Hi, my name is Alexis de Belloy, and I work for the Skoll Global Threats Fund. Some of you may have heard of Jeff Skoll. He was one of the co-founders of eBay. Jeff does a number of things, but this being California, at one point he realized maybe there were a couple of threats that could bring humanity to its knees, and that a small group of people with an innovative mindset might be able to make a difference. Full disclosure, I don't have a background in emergency preparedness, in epidemiology, but I do have a lot of consumer internet background, and that's part of the reason why I have this funny title of entrepreneur in residence is because we're trying to mix traditional public health with more innovation to create that resilience that we're talking about in terms of preparedness. You see this slide, ending pandemics in our lifetime. So amongst the, I'm not going to talk about all the threats that we cover because there's the nuclear proliferation, climate change, water as a geopolitical source of conflict. But pandemics obviously is a big threat, and I don't have to explain this to this community. We actually believe that we can end pandemics in our lifetime, and that's the mission statement, if you like, of our team. All of you will know what a epidemic curve will look like, and the difference between that bigger curve and the smaller curve is really about how quickly you can detect it, detect the outbreak, verify it, and respond. And we focus a lot on the detection piece. We feel we can make more of an impact. And Larry Brilliant, who was our founder, basically says, outbreaks are inevitable, and we all know that they are. We believe that pandemics are optional if we are sufficiently prepared. This is a bit of an eyesore, but really what it shows is, how do we detect outbreaks today? The traditional means of surveillance is based on surveillance networks, and it starts if you've got the patient 0, on the top left who has symptoms. At some point, that patient or somebody that he or she has infected will seek out local health care. The local health officials will be notified. It might be confirmed in a lab, and then that information kind of slowly, makes its way up to the Ministry of Health or WHO if it's cross-border. And you have a similar, at the bottom, you have a similar type of process for animal health, because as we well know, diseases tend to jump from animals to humans. What this process creates is quite a bit of a lag between the moment when the outbreak occurs, and the moment where it's actually detected, registered, and verified. So we concentrate our effort at Skoll on a number of areas. One is trying to detect the outbreak actually at the patient level and by leveraging technology, and I'll get into that a little bit more, and we call this participatory surveillance. The second thing we do is, we want to be able to verify cases faster, so we have a lot of our effort that's also on, training and linking field epidemiologists, and then linking them up to platforms where an alert can be seen somewhere, sent to a trained epidemiologist to check it out because they are in a certain region, and that information fed back centrally. Then the third thing, which is at a higher level, is really about connecting national and regional surveillance networks. The way WHO is set up, it's set up with very strict regions. Those regions actually don't always map very well to where there's the most risk and who needs to be talking to each other, so we also try to play a role there. Let me focus for a tiny bit in terms of, we talk about this being a public health issue, how we actually put the public back into public health and this participatory surveillance. And I'm going to talk of it, this is a novel idea, so when it's a novel idea, you have to test it out somewhere. And we have a nice virus with influenza. And I say nice, not so nice in terms of the number of people that it kills, but interesting from a, if you're going to test a new system, you need to be able to benchmark it against something. And as you know, influenza is a seasonal disease. It comes back every year, so it's reasonably predictable. And in the United States, we actually have a pretty good surveillance network for influenza. And as you're testing a novel system, you want to be able to benchmark against something. Flu Near You is both a website and a phone application. People register with very minimal information, just an email address, gender, and a zip code so that we can geolocate. And then on a weekly basis, you get a quick survey that says, have you had any of these symptoms last week? So no, we don't ask you if you've had the flu. As you know, we can't tell you whether we have the flu, I don't think. Enoch could tell you if you have the flu, but a lab test might be able to.
Yeah, only if you let me swab your throat.
Exactly. And then based on that, we can create a map of different symptoms, and when we have influenza-like illnesses, as defined by the CDC. And what's been really interesting is we now have 3 seasons behind us, and actually the signal that's generated by this system actually maps very well the ILINet system that the CDC outputs, but it does so about a week in advance. Now, of course, there are big challenges in terms of how many people do you have in there at a granular level to have a good signal, but it offers a lot of promise, and it offers a lot of promise in areas where you don't have necessarily the best surveillance network. It also complements traditional surveillance systems. Other areas where we've been involving ourselves, this is Saúde na Copa is an app that was, so if you think of a virus, mass gatherings are a fantastic opportunity for a virus to spread, right? You've got people coming from all sorts of different places, getting together in crowded arenas and then flying to different places. The World Cup in Brazil was such an event. Saúde na Copa was a participatory surveillance app that allowed the public to basically report on symptoms, also have information and have access to where to go to. So you had a map of where all the dispensaries were. You had a map of the available pharmacies, et cetera, et cetera. There was some gamification also that made it kind of fun. The more you participated, the better you could your little emoticon could change, and you gathered rank, and that was quite successful. Dr. Me in Thailand. So Dr. Me is a little bit more of a WebMD type platform. So as you know, I can't remember what the number is, but it's something like 90% of people will go and seek health information online either before or after seeing their doctors. That's probably some of the second guessing that they do of you. And on, bolting on the back of that, the participatory surveillance bit allows again to have that enriched signal. And you may have heard of other signals that are passive, like Google Flu Trends, where you can look at how people are searching for specific symptoms or specific diseases online, and that also generates a signal. There are people who have worked with Twitter feeds as well to show signals. So we have a much larger tool in terms of surveillance and preparedness. The second area that I was talking about is really about linking up the regional networks. And basically here, this is really about sharing information in real time and making sure that responses are coordinated across borders. Viruses pretty much ignore borders. They travel on planes, they travel on trains, they travel on roads. And if you don't have that level of preparedness that you were speaking about just a minute ago in terms of, common language, common tools, while you might detect and start a response locally, by the time you've made an impact, it may have spread to a different country. So we support an organization called CORDS, Connecting Organizations for Regional Disease Surveillance, and we're looking to foster that. One of the things that we do also as part of this is really try to foster ideas at the local level. So we can have great ideas here, but they only really work if they're implemented at the local level. And the best way to do that, we run things called EpiHacks, where we will get technologists, epidemiologists, and local health officials to work together for a week and really tackle some problems that they're facing. And what we see is we do see solutions that come out of that, but we also see a level of collaboration and know-how that we believe is incredibly important in terms of that resilience and that preparedness. If you're interested, feel free to sign up on Flu Near You. The more participants, the better the signal. Thanks.
So we have 15 more minutes for, we have some scripted questions, and we'll let you guys have some questions from the audience as well. I think the coolest idea here is that there's a great deal of empathy that's generated when there's a disaster, and I'm so interested in seeing how, Jason, how does Openideo harness that interest and energy? How is it coordinated to address emergencies on different scales? For example, Ebola on the global scale to Baltimore riots, I think you mentioned in our call, or in something so personal as the health of the Hispanic population that are watching TV, if you can address that.
Thanks. So I think that I'll tell you candidly what I think that we're good at, and also mention something that we're not yet good at. What I think that we're good at is taking an influx of interest and turning a crowd into a productive team. And the way that we do that is by providing a roadmap for their process. And for us, that roadmap is design thinking, right? So it's not just crowdsourcing. It's not just an openness and letting anyone submit anything. It's providing a structured methodology that our challenge structure is based on, and that our design process is based on, that allows people to come together and work together, and not just in an unstructured way, but through a very clear process, so they know what they're supposed to be doing when, they know what's coming next, they know how they're supposed to work together, and it's based upon a design process that's been proven and that works. What we're not good, and this is actually the case for, say, addressing something like the Baltimore riots or just other things that are coming in the news, is that our model is that we launch challenges, put in a lot of time recruiting and supporting the participants, and helping our partners and sponsors get a lot out of the challenges and be able to take the participation, the challenges, and the inputs and ideas and turn them into real world impact. What that means is that it's somewhat costly to launch a challenge, and so responding very quickly to items that are in the news is actually very hard for us. And so we're not yet good at being able to say, oh, there's a water crisis in California, let's launch a water challenge. We're dependent upon really a sales cycle of going out, finding sponsors, finding other partners, and saying who will work with us on this so that we can afford to put up a challenge and give it the attention and support that it needs.
Well, thank you. That leads right into a question I had for Tina about these slow-moving disasters. The California drought's already here, so what's the tipping point? What are the actions that the state of California are doing, since it seems like they've decided that we are in a drought? And do you have more involvement because California is such a progressive state, and are people more involved maybe in CERT, community response? And so are they more willing to participate in activities? And do you have any activity around changing or responding to popular opinion? People think that, well, if those farmers would just use less water, we wouldn't have to actually cut our shower short and things like that, or we could have green lawns and things. I mean, what are the ways that you respond into a slow disaster like this drought?
Well, I would argue that we've already tipped, but I know that not everyone would agree, because if we've got water, right? We go to the faucet and turn it on, water comes out. So it's not a panic mode. But we also realize that conserving water to avoid a panic mode is a big ship to turn. And a lot has to be done way, way ahead of time to turn that ship, and it has a lot of tendrils, like you said, because inevitably what comes out is a little finger pointing or a lot of finger pointing about what everybody's doing with water and questioning things that have been around for 100 years or more on how we've worked. And the thing that I've learned with the drought, and I was no water expert, I'm kind of a generalist in all crises, but and there's a lot of people that are water experts that they taught me a lot of stuff, is that we relied on a system that was Mother Nature gave us, and it just kind of didn't work for the last couple of years, and all of a sudden we're kind of organizing around that, both in a crisis mode. There are communities without water, and you've read about them probably, and it's happening. There are places in California where households don't have water, but a lot more has to be done to change things in California that we've come to just grow used to. Snowpack melts, gives us our water system, and we go on our way, and that just didn't happen. So it's a acceleration, if you will, or maybe it was the cause of change in water management for California. But either way, I don't think life will be the same, once we get through it. I think that some permanent things need to be done and will be done because of this. And maybe drought is, or what we're calling drought today, will be normal for all of us going forward. And we're just going to learn to live with a new baseline because it may not ever be the same again. And I think that's the part of the sort of the, how these things progress when they're slow moving, is that pretty soon maybe it's not a catastrophe anymore. It's just the way things are. And then we adjust to that as just a different way of life for all of us. And, who knows, maybe there'll be no lawns in the future, and people think that was really silly that we had lawns in the first place. No offense to anybody who has lawns, but it probably will be a game changer at some point, and not unlike other times. We had a drought about 40 years ago, and a lot was changed, and they have disasters like this that are really touch everybody. Everybody needs water. There's no one exempt from that need, but it will have a more wide-ranging effect, or the most wide-ranging effect of anything.
Well, it sounds like your answer says that it's happened, and you've got to deal with it. So, how do we encourage for Jason and Alexis? I don't know if there's technologies that you covered today or didn't cover today that can encourage the public to acknowledge that or to respond to something that it doesn't seem to really bother them that much. They turn open the tap and there's the water, or other things that are you mentioned that you're trying to encourage better health in the Hispanic population, or other. I don't know if there are other Skoll things that are looking forward and trying to. How are you engaging your participants? How do you entice them to come in and participate?
Well, I think one of the things that we talked about is less technology and more social science. And it's interesting that you spoke about the fact that fear is not very good at getting people to act. And it's counterintuitive because fear really gets our attention. And I'm French, and I'm always struck by how in the U.S. fear is all over the place. It's in the media all the time, and it's there for a good reason. It gets attention. And actually, if you see this banner ad that was run for Flu Near You, and I take full responsibility for this one. I ran that during the peak of the influenza season. That has really great click-through rates. It actually gets people into Flu Near You. The problem is people drop off, right? So they get in thinking, ooh, I want to know if my zip code has high flu levels. But we're talking about preparedness, and we're talking about something more altruistic. And people who come in thinking, wow, digital disease detection is super important, and I understand the value of that, and I understand the value of education around learning more about viruses and teaching my kids about washing their hands. Those are the people that will stay and will complete that quick report every week and lead to a valuable signal. So in terms of preparedness and resilience, I think there's a bit of a mind shift that we need to have, which is, scaring people over and over doesn't work. It brings apathy after a while, because you cry wolf, number one. Number two, we don't like fear. We like fear, we like listening to it outside, but we were talking about this. If I start doing preparedness inside my home out of fear, I'm actually bringing the disaster inside my home. I have 4 kids. Putting those shoes by the bed is making me think of an earthquake hitting my kids, and I don't like that. So I kind of don't want to do that. So social science, I think, has a big role to play.
I'll add to social science, social media. So you could think of some of the more successful ways to get people involved in different issues. And for as excited we were in terms of the turnout that we saw for the Ebola challenge, and for as many different volunteers as that effort probably recruited, you might actually think that the ALS challenge that you probably saw last summer on YouTube and on Facebook reached probably even more people. So there's just some tremendous power of being able to spread ideas in ways that tap into the digital behavior that people are already not just using but enjoying and integrating into not just their professional lives but their social lives. And you mentioned our challenge right now on Healthy Lives Challenge, which is focused on improving, using technology to improve health within the Latino community, and social media is absolutely a big part of that focus. The rates of mobile and social media usage within the millennial community of Latinos is far beyond any other group, and so we're very much focused on how social media can be relevant for that.
Well, we have 5 more minutes. I'm hoping that we can cover a couple questions. If you guys can be very concise with your, and focus, and please don't make a statement. We have so little time. Is there any questions, anyone that, otherwise I do have more questions, but I thought that you guys would have something burning that you'd want to know about. And if we, let's see, we do have a couple more questions. Let's see. So I guess the other questions were all about engagement. I guess is there techniques or strategies that the state of California is using to try and encourage? I know, like in my own town in Palo Alto, we have these really great hackathons that the city wants to open their data up, and they want to let the hackers. There's all these startups that are little companies like Facebook that started there, and things that can take that data and do amazing things for the city. Is the state of California trying to how can they engage, and what are their strategies to get not just the hackers that are here in this room, but just the regular citizens that are out there, and just I'm sure that maybe they'll use Facebook a little bit, but they're certainly not going to be programming something in C++ or something.
Well, for us, in addition to the research that taught us that fear doesn't cause people to do action, we also learned that people will most likely react in preparedness mode to something that they see someone else do at a neighborhood level. So for me to get on the news right now and say, everybody should prepare, they're going to be like, I don't know you, why should I listen to her? Now, if it's a crisis and I'm doing a press conference and talking about, what roads are closed and giving people instructions, that's another thing. People want government there to do those things. But in preparedness, this just doesn't really work. And so for us, it's like recognizing community leaders and community groups, because we know that we will, that's the huge amplifier, is when it actually is built there, and the trusted, kind of neighborhood group is the one that's, not unlike the other barbecue or anything else, that's where you really get things to work. And so people seeing you, I applaud just talking to you a few times. I know you're a model disaster preparedness. I'll bet you've motivated more of your neighbors than anything at a higher government level could possibly do. So we encourage that, and social media, of course, being the sort of the way that people communicate, and a great amplifier to get people kind of trusting the preparedness mode because they've seen somebody else do it that they know.
I'll just add to it. What we see, at least in our challenges, but I think it might have a wider application, is we see great participation coming from universities and also within the workplace. So you think about, where do people spend their time, and who are the organizations that can actually convene people and integrate preparedness into their thinking or into a group activity. And definitely, being a parent, school has a very strong convening function in our community. As they say, there's an event and it's related to our kids' safety, we're going to go. And likewise, at work, we're integrating things like water scarcity into just how we use water in the office, and I think it's affecting how people take that behavior home.
I don't know if Skoll has technologies that are being leveraged within social media, like as there is flu near them. Are there these, instructions to limit your connection, wear the mask so you can keep those fomites from heading over to other people? Or is there education provided?
Yeah, so we use social media, and actually, the boundary between actually social media today and advertising through social media is actually quite blurred. So I think when you're trying to get a message across, you don't have to have the most successful viral campaign. And by the way, if you're trying to do that, you're better off going to Las Vegas and trying a crapshoot, and you're more likely to be successful because there is just so much competition for viral attention. But you can buy your way into very significant social media presence. I think the other thing which is related to this is, we're talking about preparedness, and the thing about preparedness is the bang for buck is deferred. So the gratification is deferred, right? So it will pay off that you did all the things that you did at your home that I haven't done the day the earthquake strikes. In the meantime, it's cost you something, and it hasn't cost me much to ignore it. So the focus here should be, well, what can you put in terms of gratification earlier on in the process? And I gave that example around, Saud Nakopa. I mean, a lot of you probably use Waze, to figure out traffic and routes. And, you get, my wife was, on a drive to Tahoe a couple of weeks ago, was like, oh, this is great. I'm now a knight or a prince or something. I don't know what it was. But, they give you a crown for reporting, reporting that there's a stopped vehicle on the side. Really, it doesn't give you much, but people count their points. So, if you can think about it this way and engage us in the way that we're used to being engaged, which is, we grow in terms of our social level on social media, and you can bring that in. That's useful.
Well, it is time, but we had two questions. Of course, just as time is out. It's going to flip a coin. We'll have one very short question.
Real quick one. Alex Go with Breed Associates. Do you guys use any type of hotspotting, advanced analytics as you look at a state level view and using some predictive modeling efforts? Is there a coordinated effort there in any of the cases you guys have rolled out? Thank you.
Well, in our case, we're very much a consumer of scientific information and modeling. A lot of our crises that California is at risk to, we have historical data, and we're able to kind of use modern technology and artificial intelligence. Now there's just so much that can be done to help refine more and more what to help us be prepared for, or to even know right after an earthquake hits, where the largest damage may be before we can actually get up. So we're a big consumer of that, most certainly. So for us, yes, as technology advances and the more and more we can refine what we know quickly and better yet prepare, then that's absolutely a core part of what we do.
Yeah, there's some really strong work that's actually not being done by us in terms of trying to figure out where you want to put additional effort. And so both on the detection side, so if you think of this as a sentinel network, and there are different populations, one of the cool things about participatory surveillance is a lot of people don't go to the doctor. So if you have a population that doesn't go to the doctor very much, you want to probably focus your recruitment effort in that population because you're going to be able to see things that the traditional surveillance system doesn't see. The other thing where kind of the data, the quants are really focusing is trying to figure out, okay, well, how is the disease going to spread, and how much information can I have about prioritizing efforts? And that can be, vaccine distribution, it can be, drug distribution, it can be staffing. So there are competitions every year in terms of, predicting the influenza curve and where it's going to hit. help tell people, look, the nurses are not going to be on holiday that week. So there's a lot of science that is helping on the preparedness side.
Well, with that, thank you so much for joining us. And if you have additional questions, I know there's a couple of questions, please feel free to come up and join us up at the podium. And we may have to leave the podium, but please feel free. And a big round of applause for our panels today.